So, Amar, what can I say? Warm, warm welcome. I remember your face so well. Yeah, it's been some time, isn't it? So well. So, congratulations from all of us here. And even though everyone is not here, we've all so happy, so excited, each one of us, that you made it. It is a big thing, and this will be a landmark. This will change your journey. And depending on where it will be like multiple doors will open. And it's only up to you where you want to take it. Okay. It depends where you want to take it. I'm telling you, and there are so many things you can do. So, how are you feeling? Just tell me how you're feeling, Karan. Amar, just tell me how you
I'm
feeling.
feeling very happy and relieved, sir, first.
Relieved. It's like a big load off your head. So brilliant now. So just give us, so for everyone who doesn't know you, just give me a brief idea, introduction about who you are, where are you based, what are you doing, so that people know your thing. Yeah.
Yes,
Give
sir.
your full name. Yeah.
My name is Dr. Amar Devaguru. I'm working in Hyderabad, sir. I finished MBBS in Chennai in SRM Medical College. After that, I had done DCH in GSL Rajahmundry, sir. After that, I had done DNB Pediatrics as well.
Okay.
So after DNB Pediatrics, I went into private practice, sir, in Hyderabad.
Okay.
So, and there were two options. Either I could go for prepare for DM. My few
Yeah.
other friends were preparing, and or few of my friends were preparing for MRCPCH.
Okay.
So they were already into the journey, sir.
Okay.
So they said that the MRCPCH is better, and life in the UK will be great. And if you complete the CCT, it will be good.
Okay.
So that is when I initially started my journey. So.
Okay. So what was your main, like compared to DM, as you said, you had this road in front of you, or your private practice. So what was it about MRCPCH that really you wanted to, rather than going for DM or practicing? What was it that made you decide, no, I want to do MRCPCH?
So, in the DM, actually, we have to go completely into the adult branch, sir.
Okay.
My few of my friends went into neurology, few of my friends went into cardiology. So, initial year, the first year, they were they had they had a little bit of difficulty as well. And moreover, I like pediatrics a lot. So,
Okay.
wanted to do something in the pediatrics itself.
Pediatrics.
So that's the main reason. I didn't
Okay.
want to let go of pediatrics. So.
So was the DM not in pediatric, like pediatric neurology? So was it adult basically based mainly initially?
In the very less seats are there, sir.
Okay.
Fellowships are there, I think, sir. But
Okay.
only in PJ Chandigarh, I think.
Okay. So that was one thing. All right. So now tell me about when you started your journey for the MRCPCH, and just which year, just to get to people get an idea about the time frame. When did you start preparation? People very often ask us how long it takes, when I start. And if you see, very often some people pass in first chance, but very often people don't. I struggled several times in theory. I'll be
Mhm.
honest. So people, it is very open to know that, because otherwise some people in audience think, oh, some people, oh, everyone who does it, they pass in first attempt. But it's not that. I know some of the best consultants, my seniors in the UK, were very senior people. Afterwards, I came to know, they said to me that, we struggled. Some of them, I was shocked. I thought, "Arey, this is such a genius person, such a respected person." They said, no, initially they went through very difficult stages. And perhaps that's why later on they became very great teachers. They were so respected. They understood the pain of the students. So tell me about your journey, how, when you started, and, how long it took
Yes.
you, which year you started.
Um, I started immediately after my DMB, sir, actually.
That was
So
which year? Which year was it around?
it was in 2018, sir.
Okay. You started your theory
2018.
and theory and all that. Okay. Then?
Yes, sir. After a few months after my DNB, I started preparing for
Okay.
FOP and TAS.
Okay.
And I cleared in first attempt, sir.
Okay. So theory was not a problem. Okay.
Not a problem.
That clinical, was it a go at first one chance, or did you get stuck few times, one months or something? How was it with your clinicals?
So actually, after the FOP and TAS, I had a chance only after then came the COVID first wave, sir. Actually,
Okay, okay,
so then they had placed a remote exam. So
okay.
AKP I had given in my home itself.
Hmm.
So that also I cleared in first attempt, sir. So that one year gap was there between FOPTS and AKP. So I mean I didn't get the chance at
Okay,
that time.
no, understood.
Exams
Yeah.
were there. After that, there was even though I was applying for nine times, I didn't get the seat at all. So it
In
was
the
there was
clinicals,
for clinicals, 3 years.
there was a huge delay. I know a lot of people, they get very discouraged at that point of time. So or 2, 3 years you're just waiting to get a seat. So when you finally get your seat, when was that first time, or you got your seat straight away? Yeah.
No, no, sir. I almost gave up on my journey. Actually, I wanted to go to UK, so that was the
Yeah,
main reason why I
I
was.
understand. Yeah,
Yes,
you wanted to work in the UK, maybe stay there. Yeah,
yes.
okay.
So,
So you
I
waited, you applied 9 times, you said, and finally you got the date. Yeah. Okay.
Yes, at that time I was not at all prepared. I was not studying at all.
Okay.
So at the, just when the seat got confirmed, even before the seat got, I was not prepared. Actually, this
Okay.
time also it might be it will be getting rejected. That's what I thought.
Okay. Okay.
So
So is this the first time you gave your clinicals, or was there one time before where you gave and it wasn't
this is the
successful?
second
Or
time, sir. Actually, I gave in
Mhm.
October in Mumbai.
Okay.
So I got 60 marks, sir. I failed by 2 marks.
Okay.
So but luckily on the day of the result itself, another opening was there for the
So you applied
February.
straight. Okay.
So I applied on the same day itself, sir. So
Absolutely. So that's a big learning for everyone, that there's no time for being self-pity or doubt. The day you got the results, you found you've not cleared, same day you applied straight away, isn't it? So that
yes,
shows
sir.
you have to be definitive on your journey. So do you mind sharing with us what do you think went wrong? What was your approach? You said you were not prepared, so that is
Yes, sir.
okay. But what was it that you really got wrong in the first time, which made a difference, which you
Yes,
could have done better
yes.
in the first time?
So actually, I was the first time I joined in Doctor Academia, sir. At that
Okay,
time,
you were there
so
with
Doctor
us, yeah.
Academia, yeah, yes,
Mhm, you
sir.
observed.
I was very strong in development. I got
Hmm.
full marks in development in Mumbai,
Hmm.
and even the history and communication also was good, sir. But clinicals practicing on the patients was. In that 6 minutes, I was not able to do. I was a little bit confused, sir. Actually,
Okay.
I didn't practice properly. I was practicing in the oral manner, but I didn't practice well on the patients. So in the
Okay.
clinicals, I made the difference, sir. Actually,
Okay. So
that's
practicing
what
on
I did.
patient was not a big thing. Okay. So now, just tell me what. So if it's similar to that, what so your challenges? What was the main challenges, and which you found in MRCPCH individually? What was your main, your challenges? Was it just development, or what was your plan, or just the clinical part?
Clinicals, yeah, I definitely keep clinicals as the most challenging part.
Okay.
So why? Because in the 6 minutes time frame, we have to identify the diagnosis and we have to complete the examination as well. And in the 3 minutes, we have to present it.
So that was a main challenge. So how did you come to know about us, Dr. Academy? How was it that you came to know? Was it a friend or ad or
Actually, I joined in Dr. Pranab practice group. They took coaching from Dr. Academy and started a practice group. They were
okay, okay,
practicing very rigorously.
okay, okay,
So at the time, I asked them which coaching to join. I have only 2 months, so that's
okay,
when they advised me to go to Doctor.
to our
That's
group.
when
Okay,
they joined me.
okay. So again, here when you came to this group, what was the expectation, and where do you think we actually were able to help you? What specific points do you think? You don't have to name any of the teachers, all the staff, but I just want to know where exactly we were able to make the difference for you, and specifically because it will guide the others also. So where did we make a difference in your preparation? Just a few points.
Actually,
Mm.
the structure itself I got from Dr. Academy, sir. I had
Mm.
no idea what to do. I had no idea how to present, how to take the
Okay,
history or
okay.
anything. I was totally a blank slate
All
when I
right.
first came into this thing.
Okay.
So
Uh,
that's when I started building up. That's when they gave the material, reading material, where to read and how to present and all. So
okay, okay,
I give my credit to.
okay. So you
So
got all the stuff here only. All
yes.
right. Okay. All right. Okay. So that's good. So you basically got a whole idea A to Z about how to prepare and everything. All right. That's wonderful. Okay. Anything you feel we could do better, or because for future generations, anything we could add to help others? Anything different we could have done to help?
Yes. In the first time, I didn't see. I was. Few people were saying that we can see in the OP. You can see practice in the OP, practice in the
Ah,
manner of
okay. Ah.
MRCP clinicals. But it is not practically possible, sir. You can't look for devices in front of the patient. The mother will be
Hmm.
standing,
Ah,
and you can't time yourself. So
okay.
even though I felt. So what I did was in the second time, I and my friend went to Nilofer Hospital that is in this one. So we used to practice with each other.
Okay,
So yes,
that made a difference.
yeah,
Okay.
that made a difference.
So what is your advice to the young candidates, the fresh candidates who are here, who are facing struggles, who are not sure whether they can do the exam, they're feeling it's very difficult. So what would be your, one or two, maybe three advice very quickly? What would be advice to them?
Firstly, follow the mentors actually and listen to them carefully. And secondly, rather than studying in a group of to four people, it is better to study one to one, sir. Why?
Yeah,
Because that's where you will get a chance to present one to. It is very important to be on hot seat.
yeah,
If you're not in the hot seat, then there's no point in
no point. Yeah.
learning about this.
Okay.
So
So
and
that
see the clinicals is important. So we have to see the cases. They are expecting the diagnosis in the exam.
So yeah, some cases there at least the questions are around the diagnosis, at least differential diagnosis. So you should have some idea. So you are saying that you should see wide variety of clinical cases as well. Okay. So thanks a lot, Dr. Amar. It's so nice. I wish you best of luck that you pass. So what are your plans now? What is any immediate thing you want to go to? Are you planning to go to UK or
Yes, sir.
will you apply for jobs?
Yes, sir.
Okay.
My OIT is expiring on June, sir. So I'm waiting for the slips to come so that I
Okay.
can complete the GMC registration.
Okay.
So after that, I
Okay.
want to apply the jobs over there.
Okay. All right. So we'll be in touch and maybe we will be able to help in some way. So we'll be in touch. Okay. We'll get in touch later on. So thanks a lot. Enjoy. Okay.
Yes,
And
thank you,
we'll
sir.
keep in touch. Thank you so much
Thank
for your
you.
time. Thanks for coming here. Okay. So I'll just end it now. Thank you so much. Okay.